having case study 1, Mary Cooper. We're going to use the quality use of medicines approach to identify and describe all actual and potential therapeutic problems Mary is experiencing. Mary is currently taking 2 500mg paracetamol tablets 4 times daily when required. Paracetamol is a non-opioid analgesic used for moderate to mild pain, which Mary is taking to control her joint pain. There are 0 side effects from paracetamol when taken correctly, and Mary has experienced no efficacy issues with it. She hasn't complained of any pain in her case study, so we're assuming that the current use of paracetamol is effective and no changes are required. Mary has been prescribed 100 micrograms 2 puffs daily of beclomethasone. Beclomethasone is an inhaled corticosteroid used for maintenance treatment of asthma and COPD, which works by reducing airway inflammation and bronchial hyporeactivity. Mary needs to ensure she's using her inhaler correctly. Asthma patients who smoke, such as Mary, may respond less well to inhaled corticosteroids than non-smokers and may require higher doses. Mary is currently being prescribed 200 micrograms daily and may require a higher dose. Adults are able to take a maximum of 800 micrograms per day. There are no appropriateness issues. If Mary's dosage gets increased, she may have to be reviewed after a certain amount of time. Mary's also taking up to 200 micrograms daily of salbutamol. Salbutamol is a short-acting beta-2 agonist, or SABA, used for the symptom relief of asthma and COPD. Works by stimulating beta-2 adrenoceptors, resulting in relaxed bronchial smooth muscle. She also needs to ensure she is using her inhaler correctly here. Asthma patients who smoke may also respond less well to inhaled SABAs than non-smokers and may require higher doses. AMH states that high or increasing usage of SABAs indicates poorly controlled asthma and requires review of management. Mary may benefit more from using a fixed-dose combination inhaler. These ensure the use of a long-acting beta-2 agonist and inhaled corticosteroids. They're used for the maintenance treatment of asthma in patients receiving inhaled or oral corticosteroids, which Mary is already taking in the form of beclomethasone.
Diclofenac is a NSAID used to treat Mary's arthritis. She is currently taking a 50 mg tablet 3 times daily. Mary's joint pain is an indication for diclofenac. However, precaution needs to be exercised when NSAID is being used by patients with asthma, as asthma is a potential contraindication. With Mary's current shallow and wheezy breathing, diclofenac is not appropriate. Seek specialist advice for further investigation, diagnosis and management. It is possible that the patient may tolerate an alternative NSAID. There is no efficacy issue surrounding joint pain, as she is not complaining of any pain in the case study. Comorbidities are present in Mary, so non-drug treatments such as regular exercise, weight loss, physical therapy, and arthritis self-management. Patient education should be the first treatment option, followed by drug treatment in the order of regular paracetamol, topical NSAIDs. St. John's wort is a natural remedy used to help with some forms of depression. It can be bought over the counter at all pharmacies. No prescription is needed. Combining St. John's wort with certain antidepressants can lead to potentially life-threatening increase of serotonin, a brain chemical targeted by antidepressant. It can limit the effectiveness of many prescription medicines, including antidepressants. Fluoxetine is a selective serotonin reuptake inhibitor that selectively inhibits the presynaptic reuptake of serotonin. This is used to help with major depression, obsessive compulsive disorder, and premenstrual dysphoric disorder. Common side effects of using fluoxetine include nausea, diarrhea, agitation, weight loss, anxiety, and insomnia. This is not ideal for Mary, as she is already suffering from lack of sleep, weight loss, and anxiety. The dose of 40 mg of fluoxetine each night is not adequate. The starting recommended dose of fluoxetine is 20 mg per day, gradually increasing to 60 mg as necessary in the morning. Mary has been started on 40 mg initially. Mary should see medical practitioner. Doctor should start treatment by seeking explanation for cause of grief and distress.
After reviewing Mary's current situation, we are questioning her prescription of fluoxetine. There is still an indication for an antidepressant present. Mary was prescribed fluoxetine. However, Mary also takes St. John's wort and suffers with insomnia. Due to these having an adverse effect, the fluoxetine, an alternative antidepressant medication, will need to be explored to achieve a better outcome from her medications. Citalopram belongs to a group of drugs called SSRIs, with minimal or no side effects on noradrenaline, dopamine, and gamma-aminobutyric acid uptake used in the treatment of depression. Some of the most common side effects are aggravated depression, an increase of saliva, hypertension, migraines, and weight changes. The starting dose is 20 milligrams per day and can be increased in increments of 10 milligrams 2 to 3 weekly, with the maximum dose being 40 milligrams a day. Contraindications say that citalopram should not be used within 14 days of or in conjunction with monoamine oxide inhibitors or the reverse inhibitors of monoamine oxide A. Adverse effects of citalopram are generally mild and transient and are typically most frequent in the first 1 to 2 weeks of treatment. A very common side effect of fluoxetine is insomnia. Citalopram does not have insomnia as a listed side effect. Fluoxetine and St. John's wort, the herbal remedy that Mary has recently started taking, can also have negative pharmacodynamic interactions, resulting in an increase of undesirable effects. Citalopram has not been shown to have these negative interactions with St. John's wort and does not have insomnia listed as a common side effect. Therefore, citalopram is a better choice of antidepressant for Mary.
We believe that in order for Mary to have a better quality of life, her current lifestyle conditions would have to change. In order for Mary to accomplish this, Mary should go back and see her general practitioner and have her new medication of fluoxetine reviewed and potentially changed. Speak with her healthcare professional about her asthma inhaler, making sure she's correctly using it. To seek medical help from a doctor, psychiatrist, counsellor, lifeline, friend or family member to help with her current stress. To speak to her boss about reducing her current workload. To seek medical advice from a rheumatologist to help manage the pain of arthritis. To talk to a doctor, pharmacist, or a quick coach about quitting smoking, to see a dietitian to help with her current eating status, getting into a good sleep hygiene, and to start in a social group or hobby to meet new people and make friends.